Question 1. Which approach would be most aligned with the principles of play therapy when a child is engaged in solitary play, pauses for a significant period, and then resumes play without any verbalization or apparent distress? Option A. Maintain a quiet, observant presence, allowing the child to continue their exploration without interruption, trusting that the silence and space are part of their processing. Option B. Begin to narrate the child's actions to encourage verbalization and provide a sense of external structure to their play. Option C. Immediately ask the child what they are thinking about or feeling during the pause to ensure they are not experiencing distress. Option D. Gently offer a new toy or suggest an activity to re-engage the child and fill the perceived void in the play. Correct answer is A. Maintain a quiet, observant presence, allowing the child to continue their exploration without interruption, trusting that the silence and space are part of their processing. Explanation. This scenario presents a common challenge in play therapy, balancing the child's need for exploration with the therapist's responsibility to facilitate therapeutic progress. Professional challenge lies in discerning when silence and space are essential for the child's internal processing, and when they might indicate a need for gentle intervention or redirection. Careful judgment is required to avoid imposing adult expectations or prematurely interrupting a potentially crucial moment of self-discovery. The correct approach represents best professional practice because it prioritizes the child's autonomy and the inherent healing power of play. By allowing ample silence and space, the therapist demonstrates trust in the child's capacity to lead their own therapeutic journey. This aligns with ethical guidelines that emphasize client-centered care and non-interference, unless therapeutically indicated. Specifically, in the context of play therapy, the regulatory framework often underscores the importance of creating a safe and unhurried environment where children can express themselves through play. Allowing silence and space respects the child's pace and allows for the emergence of unconscious material, which is a cornerstone of many play therapy modalities. An incorrect approach that involves immediately filling silence with questions or directives fails to acknowledge the child's internal world. This can be interpreted as a lack of trust in the child's ability to self-regulate or communicate effectively through play, potentially leading to the child feeling unheard or misunderstood. Ethically, this could be seen as imposing the therapist's agenda rather than facilitating the child's. Another incorrect approach, such as interpreting every pause as a sign of distress and attempting to fix it, can disrupt the child's natural exploration and prevent them from developing coping mechanisms independently. This might violate principles of respecting the child's developmental stage and their right to experience a range of emotions within the therapeutic setting. A further incorrect approach, such as becoming overly anxious about the silence and engaging in excessive self-talk or distracting activities, demonstrates a lack of confidence in the therapeutic process itself and can inadvertently create a less secure environment for the child. The professional decision-making process for similar situations involves a continuous assessment of the child's verbal and nonverbal cues, the overall therapeutic context, and the specific goals of the session. Professionals should ask themselves, is the silence a moment of deep concentration, a pause for reflection, or a sign of discomfort? Is the space being used for exploration or avoidance? The therapist's internal state is also crucial. A calm and observant stance allows for more accurate interpretation of the child's behavior. When in doubt, observing for a sustained period before intervening is often the most ethical and therapeutically sound choice, allowing the child's play to guide the process. Question 2. The review process indicates that a certified play therapist is working with a child who is exploring a new toy. The therapist is considering different ways to engage with the child's play, aiming to foster development according to Vygotsky's sociocultural theory. Which of the following approaches best exemplifies the application of Vygotsky's concept of the zone of proximal development (ZPD) in this play therapy context? Option A. The therapist actively participates in the play, offering suggestions and modeling slightly more complex ways to use the toy, thereby guiding the child to a new level of engagement and understanding. Option B. The therapist takes control of the play, demonstrating specific ways to use the toy and directing the child's actions to ensure the correct way of playing is followed. Option C. The therapist observes the child playing independently with the toy, making detailed notes on the child's solitary actions and internal thought processes without direct interaction. Option D. The therapist focuses on the child's individual exploration of the toy, interpreting the symbolic meaning of the play without considering the potential for social interaction or guided learning. The correct answer is A. The therapist actively participates in the play, offering suggestions and modeling slightly more complex ways to use the toy, thereby guiding the child to a new level of engagement and understanding. Explanation. This scenario presents a professional challenge because it requires a certified play therapist to critically evaluate the application of a foundational theoretical framework, Vygotsky's sociocultural theory, within the context of play therapy practice. The challenge lies in discerning which approach most accurately and ethically reflects the core tenets of Vygotsky's work, particularly the zone of proximal development, ZPD, and the role of social interaction in learning and development, while adhering to the specific regulatory and ethical guidelines for certified play therapists. Careful judgment is required to ensure that the chosen approach not only aligns with theory, but also promotes the child's optimal therapeutic progress and respects their developmental stage. The correct approach represents best professional practice because it directly integrates Vygotsky's concept of the ZPD by having the therapist actively scaffold the child's play. This involves the therapist providing just enough support and guidance to help the child achieve a slightly more complex play behavior or understanding than they could independently. This scaffolding is crucial for fostering cognitive and social development within the child's ZPD, a cornerstone of Vygotsky's theory. This approach is ethically sound as it prioritizes the child's developmental needs and utilizes evidence-based theoretical underpinnings to guide therapeutic intervention, aligning with the professional standards of certified play therapists who are expected to apply theoretical knowledge effectively. An incorrect approach that focuses solely on observing the child's independent play without any intervention fails to acknowledge the Vygotskyan emphasis on social interaction and guided participation as drivers of development. This approach neglects the ZPD and the role of the more knowledgeable other, the therapist, in facilitating learning. Ethically, this could be considered a failure to provide adequate therapeutic support if the child is struggling to progress or could benefit from guided exploration. Another incorrect approach that involves the therapist taking over the play and directing the child's actions too rigidly misinterprets scaffolding. Instead of supporting the child's own exploration and problem-solving within their ZPD, this approach risks stifling the child's autonomy and creativity, potentially leading to frustration or disengagement. This deviates from the collaborative and supportive nature of scaffolding in Vygotskyan theory and may not be developmentally appropriate, representing an ethical concern regarding the therapist's role in fostering the child's agency. A further incorrect approach that focuses on the child's solitary play and the therapist's interpretation of internal psychological states without considering the social context of play overlooks a fundamental aspect of Vygotsky's theory. While internal processes are important, Vygotsky posited that higher mental functions originate in social interactions. Ignoring the potential for social learning and interaction within the play therapy setting would be a theoretical misapplication and could limit the therapeutic effectiveness by not leveraging the full potential of the play environment as a sociocultural space. The professional decision-making process for similar situations should involve a thorough understanding of the child's current developmental and play abilities, a clear grasp of the theoretical framework being applied, in this case, Vygotsky's sociocultural theory, and an assessment of how to best facilitate the child's growth within their ZPD. This requires ongoing observation, flexible intervention, and a commitment to ethical practice that prioritizes the child's well-being and therapeutic progress, always grounded in the specific regulatory and ethical guidelines governing certified play therapists. Question 3. The analysis reveals that a certified play therapist is working with a young child who consistently brings a well-worn stuffed animal into therapy sessions. The child often speaks to the stuffed animal, uses it for comfort during difficult moments, and sometimes directs their play towards it. The therapist is considering how to best incorporate this into the therapeutic process. Which of the following approaches best aligns with the principles of play therapy and the understanding of transitional objects? Option A. Take possession of the stuffed animal temporarily to keep it safe during the session, returning it at the end to help the child learn to rely on the therapist. Option B. Integrate the stuffed animal into the therapist's own play, using it to initiate play scenarios that the therapist deems beneficial for the child's development. Without direct input from the child, Option C. Gently acknowledge the stuffed animal's importance to the child and allow it to be present in the playroom, observing how the child uses it as a tool for comfort and expression within the therapeutic space. Option D. Encourage the child to leave the stuffed animal outside the therapy room, explaining that the therapist is there to provide comfort and support, and the object is not needed. The correct answer is C. Gently acknowledge the stuffed animal's importance to the child and allow it to be present in the playroom, observing how the child uses it as a tool for comfort and expression within the therapeutic space. Explanation. This scenario presents a professional challenge because the certified play therapist must navigate the delicate balance between supporting a child's developmental needs through transitional objects and ensuring the therapeutic process remains within ethical and professional boundaries. The therapist must consider the child's attachment to the object, its role in emotional regulation, and potential transference issues, all while maintaining professional objectivity and avoiding over-identification or inappropriate personal investment. Careful judgment is required to determine when and how to engage with the transitional object in a way that facilitates therapeutic progress without becoming a substitute for the therapeutic relationship itself. The correct approach represents best professional practice because it prioritizes the child's therapeutic needs and adheres to ethical guidelines for play therapy. By acknowledging the transitional object's importance and integrating it thoughtfully into the play therapy process, the therapist demonstrates an understanding of Winnicott's theory and its application in fostering security and self-soothing. This approach respects the child's developmental stage and uses the object as a bridge to explore emotions and build a stronger therapeutic alliance. It aligns with the ethical imperative to provide client-centered care that is developmentally appropriate and therapeutically beneficial, ensuring the therapist remains a facilitator of the child's growth rather than an enabler of dependency on the object. An incorrect approach that involves discouraging the child's use of the transitional object or dismissing its significance would be a significant ethical failure. This would disregard the theoretical underpinnings of transitional objects, potentially causing distress to the child and undermining the therapeutic alliance. It could be interpreted as a failure to competently assess and respond to the child's developmental needs, violating the ethical duty to provide effective and appropriate treatment. Another incorrect approach, such as the therapist becoming overly attached to the object themselves or using it in a way that blurs professional boundaries, would constitute a serious ethical breach. This could lead to transference issues, compromise the therapist's objectivity, and potentially harm the child by creating an unhealthy dependency or misinterpreting the object's role. Such actions would violate professional standards regarding boundaries and the therapist's role in the therapeutic relationship. The professional decision-making process for similar situations should involve a thorough assessment of the child's developmental stage and the function of the transitional object. The therapist should consult relevant theoretical frameworks such as Winnicott's to inform their understanding. Ethical guidelines for play therapy must be rigorously applied, focusing on client welfare, professional competence, and maintaining appropriate boundaries. A reflective practice approach, involving supervision or consultation with peers, is crucial for processing complex cases and ensuring therapeutic interventions are ethically sound and developmentally appropriate. Question 4. Market research demonstrates a growing demand for play therapists to utilize standardized assessment tools to inform treatment planning for children experiencing complex behavioral and emotional challenges. A certified play therapist is presented with a referral for a 6-year-old child exhibiting significant anxiety, aggression, and difficulties with peer interaction. The therapist has access to several assessment tools, including a widely used parent report questionnaire for general behavioral issues, a projective drawing technique that requires abstract interpretation, and a play-based assessment designed to evaluate social-emotional development in young children through structured play scenarios. Considering the child's age and the nature of the presenting concerns, which approach to selecting a standardized assessment tool would best align with ethical and professional practice for a certified play therapist? Option A. Employ the projective drawing technique requiring abstract interpretation, as it can reveal underlying unconscious conflicts that may be contributing to the child's behavior. Option B. Select the play-based assessment designed to evaluate social-emotional development through structured play scenarios, as it is developmentally appropriate for a 6-year-old and directly addresses social-emotional functioning within a play context. Option C. Prioritize the assessment tool that has the most recent publication date, assuming newer tools are inherently more advanced and effective. Option D. Utilize the widely used Parent Report questionnaire for general behavioral issues, as it is a common tool and provides a broad overview of the child's difficulties. The correct answer is B. Select the play-based assessment designed to evaluate social-emotional development through structured play scenarios, as it is developmentally appropriate for a 6-year-old and directly addresses social-emotional functioning within a play context. Explanation. Scenario analysis. This scenario presents a common challenge for certified play therapists, selecting the most appropriate standardized assessment tool for a child exhibiting complex and multifaceted behavioral and emotional difficulties. The challenge lies in balancing the need for a comprehensive evaluation with the child's developmental stage, potential for distress during assessment, and the ethical imperative to use tools that are valid, reliable, and culturally sensitive. The therapist must navigate the nuances of different assessment methodologies and their suitability for a specific child's presentation, ensuring the chosen tool provides actionable insights without causing undue harm or misinterpretation. Correct approach analysis. The correct approach involves a thorough review of the child's presenting concerns, developmental history, and cultural background to identify assessment tools that are specifically designed for the age group and the nature of the difficulties. This includes considering the psychometric properties of the tool, validity and reliability, its ease of administration and interpretation for the child, and its alignment with the play therapy theoretical framework being utilized. Selecting a tool that is evidence-based and has demonstrated efficacy in similar populations ensures the assessment is both ethically sound and clinically useful, leading to informed treatment planning and intervention. This aligns with ethical guidelines that mandate competence and the use of appropriate assessment methods. Incorrect approaches analysis. One incorrect approach involves prioritizing a tool that is widely known or easily accessible without first verifying its suitability for the child's specific age, developmental level, and presenting issues. This can lead to an assessment that is either too simplistic, too complex, or not designed to capture the relevant information, resulting in inaccurate or incomplete findings. This failure to select an appropriate tool violates the ethical principle of competence and can lead to misdiagnosis or ineffective treatment, potentially causing harm to the child. Another incorrect approach is to rely solely on anecdotal evidence or the recommendations of colleagues without independently evaluating the psychometric properties and clinical applicability of the assessment tool. While peer recommendations can be helpful, the ultimate responsibility for selecting a valid and reliable tool rests with the therapist. Using a tool without established validity and reliability undermines the scientific basis of the assessment and can lead to flawed conclusions, which is an ethical breach of professional responsibility. A further incorrect approach is to choose a tool that is overly reliant on verbal communication or abstract reasoning, which may not be appropriate for a young child or a child with significant communication challenges. Play-based assessments are designed to bypass these limitations. Selecting a tool that does not accommodate the child's developmental and communication style can result in an assessment that does not accurately reflect the child's internal experience, leading to a misrepresentation of their needs and potentially inappropriate interventions. This disregards the core principles of play therapy and the ethical obligation to assess children in a developmentally appropriate manner. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive understanding of the child's presenting problem and developmental context. This involves gathering information from caregivers, reviewing existing records, and conducting initial observations. Next, the therapist should identify potential assessment tools that align with the child's age, developmental stage, and the nature of their difficulties. This research should include an evaluation of the tool's psychometric properties, cultural appropriateness, and alignment with the play therapy model. Finally, the therapist should select the tool that offers the most valid, reliable, and ethically sound means of gathering the necessary information to inform treatment planning, always prioritizing the child's well-being and the integrity of the therapeutic process. Question 5. Risk assessment procedures indicate that a certified play therapist is working with a young child exhibiting significant behavioral challenges at home and school. The therapist needs to gather comprehensive observational data to inform their assessment and treatment plan. Which of the following observational assessment methods would best align with ethical practice and provide the most nuanced understanding of the child's play and behavior in the therapeutic context? Option A. Prioritizing the observation of the child's interactions with peers in a group setting, without first establishing rapport or conducting individual observations in the therapy room. Option B. Engaging in extensive, unstructured note-taking during all play sessions, documenting every detail of the child's actions and verbalizations without a predefined focus or hypothesis. Option C. Relying exclusively on a standardized checklist of developmental milestones completed by the parents, without direct observation of the child's play or behavior in the therapy setting. Option D. Conducting direct, systematic observations of the child's play in the therapy room, focusing on specific behavioral indicators and emotional expressions, and supplementing this with structured interviews and questionnaires completed by the child's parents or primary caregivers. Correct answer is D. Conducting direct, systematic observations of the child's play in the therapy room, focusing on specific behavioral indicators and emotional expressions, and supplementing this with structured interviews and questionnaires completed by the child's parents or primary caregivers. Explanation. This scenario presents a professional challenge because the certified play therapist must select an observational assessment method that is both developmentally appropriate for the child and ethically sound, ensuring the child's privacy and informed consent are respected, even when the child cannot directly provide it. The therapist must balance the need for objective data with the sensitive nature of play therapy and the potential for misinterpretation of observed behaviors. Careful judgment is required to choose a method that yields meaningful insights without pathologizing normal developmental play or causing distress. The correct approach represents best professional practice because it prioritizes a multi-method, developmentally informed observational strategy. This aligns with ethical guidelines for play therapists that emphasize comprehensive assessment and the use of tools that are sensitive to the child's age and developmental stage. By integrating direct observation with information from caregivers, the therapist builds a more holistic understanding of the child's functioning within their natural environment, which is crucial for accurate diagnosis and treatment planning. This approach respects the child's right to privacy by ensuring observations are conducted in a manner that minimizes intrusion and focuses on observable behaviors relevant to therapeutic goals. An incorrect approach that relies solely on standardized checklists without direct observation fails to capture the nuances of a child's play and emotional expression, which are central to play therapy. This can lead to a superficial understanding and potentially misdiagnosis, violating the ethical principle of competence and the duty to provide appropriate care. Another incorrect approach that involves extensive note-taking during direct observation without a clear focus on specific behaviors or hypotheses can become overly subjective and may inadvertently document extraneous details, compromising the objectivity of the assessment and potentially violating the child's privacy by recording non-essential personal information. Furthermore, an approach that neglects to involve caregivers in the assessment process overlooks a vital source of information about the child's history, family dynamics, and behaviors outside the therapy room, hindering the development of a comprehensive and effective treatment plan, and potentially violating ethical standards related to collaborative care. Professionals should employ a decision-making framework that begins with understanding the presenting concerns and the child's developmental stage. They should then consider various observational methods, evaluating their suitability based on ethical considerations, the specific therapeutic goals, and the available resources. This involves a critical review of the literature on play-based assessment and consultation with supervisors or peers when necessary. The process should always prioritize the child's well-being and the integrity of the therapeutic relationship. Question 6. During the evaluation of a child's play session, a certified play therapist observes the child engaging in aggressive play directed towards a doll, involving shouting and forceful actions. The therapist notices the child's facial expression is one of intense frustration. Which of the following approaches best reflects a humanistic play therapy best practice in this situation? Option A. Ignore the aggressive play and continue with a pre-planned art activity, assuming the child will eventually engage with it. Option B. Immediately stop the play, firmly state that aggressive actions are not acceptable in the playroom and redirect the child to a different, calmer activity. Option C. Gently acknowledge the child's frustration, validate their feelings, and then offer a way to channel that energy into a more contained and symbolic form of expression within the play, such as building a safe space for the doll. Option D. Mirror the child's aggressive play by engaging in similar forceful actions and shouting, to show understanding and join the child's experience. The correct answer is C. Gently acknowledge the child's frustration, validate their feelings, and then offer a way to channel that energy into a more contained and symbolic form of expression within the play, such as building a safe space for the doll. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified play therapist to balance the client's immediate emotional expression with the ethical imperative to maintain professional boundaries and ensure the therapeutic process remains focused and effective. The therapist must discern whether the child's actions are a genuine expression of distress that can be therapeutically processed through play, or if they represent a boundary crossing that could undermine the therapeutic relationship or the child's safety. Careful judgment is required to interpret the play's meaning within the context of the child's overall presentation and therapeutic goals. Correct approach analysis. The correct approach, which involves acknowledging the child's feelings, gently redirecting the play towards a more contained and therapeutic expression, and exploring the underlying emotions, represents best professional practice. This aligns with humanistic play therapy principles that emphasize empathy, unconditional positive regard, and the child's innate drive towards growth and self-healing. By validating the child's emotions while guiding the play, the therapist fosters a safe space for exploration and processing. This approach respects the child's autonomy and agency within the therapeutic relationship, adhering to ethical guidelines that prioritize the client's well-being and the integrity of the therapeutic process. Specifically, it upholds principles of beneficence and non-maleficence by ensuring the play remains a tool for healing rather than a source of distress or boundary confusion. Incorrect approaches analysis. One incorrect approach, which is to immediately stop the play and firmly state that such actions are not allowed, fails to acknowledge the child's emotional state and can be perceived as punitive or rejecting. This can shut down communication and hinder the therapeutic alliance, violating the principle of unconditional positive regard central to humanistic play therapy. It also misses an opportunity to explore the underlying feelings driving the behavior, potentially leading to unresolved issues. Another incorrect approach, which is to mirror the child's aggressive play without intervention, risks normalizing or even encouraging potentially harmful behaviors. While play therapy involves engaging with the child's world, this approach neglects the therapist's responsibility to guide the play towards constructive emotional processing and to maintain a safe therapeutic environment. It could be interpreted as a lack of professional judgment and a failure to uphold ethical standards regarding client safety and therapeutic efficacy. A further incorrect approach, which is to ignore the behavior and continue with a pre-planned activity, demonstrates a lack of attunement to the child's current emotional needs. This disregards the dynamic nature of play therapy, where the child's spontaneous play often reveals crucial therapeutic material. It fails to engage with the child's present experience and can lead to a disconnect between the therapist and the child, undermining the therapeutic relationship and the effectiveness of the intervention. Professional reasoning. Professionals should employ a decision-making framework that prioritizes attunement to the child's emotional state, interpretation of play as communication, and the maintenance of therapeutic boundaries. This involves 1. Observing and reflecting on the child's play to understand its meaning and underlying emotions. 2. Assessing whether the play is a healthy expression of distress or a boundary issue. 3. Responding with empathy and validation while gently guiding the play towards therapeutic goals, ensuring safety and ethical conduct. 4. Continuously evaluating the impact of interventions on the therapeutic relationship and the child's progress. Question 7. The evaluation methodology shows that a child in psychoanalytic play therapy is repeatedly engaging in play scenarios involving aggressive actions towards dolls, with increasingly intense and detailed enactments of harm. The certified play therapist is considering how to proceed, balancing the exploration of the child's internal world with the imperative to ensure safety. Which of the following represents the most ethically and professionally sound approach? Option A. Continue to interpret the symbolic meaning of the aggressive play, focusing on the child's expression of anger and frustration, without immediate external intervention, assuming the play is a safe release. Option B. Discuss the aggressive play directly with the child, asking explicit questions about their intentions and any real-world desires to enact such harm, potentially disrupting the symbolic nature of the play. Option C. Immediately cease the psychoanalytic approach and initiate mandatory reporting procedures due to the depiction of harm, without further assessment of the child's immediate risk. Option D. Conduct a thorough risk assessment to determine the likelihood and severity of potential harm to the child or others, and based on this assessment, decide on the most appropriate course of action, which may include consultation, further therapeutic interventions, or reporting. The correct answer is A. Continue to interpret the symbolic meaning of the aggressive play, focusing on the child's expression of anger and frustration, without immediate external intervention, assuming the play is a safe release. Explanation. This scenario presents a professional challenge because the certified play therapist must balance the theoretical underpinnings of psychoanalytic play therapy with the practical need for risk assessment, particularly when a child's behavior suggests potential harm to themselves or others. The core of psychoanalytic play therapy involves exploring the unconscious through symbolic play, which can be a slow and indirect process. However, ethical and legal obligations mandate that the therapist prioritize safety. The challenge lies in discerning when the symbolic expression of distress crosses the threshold into a genuine risk that requires immediate intervention beyond the typical scope of purely interpretive psychoanalytic work. Careful judgment is required to avoid over-intervention that might stifle the therapeutic process, while simultaneously ensuring the child's safety and fulfilling reporting obligations. The correct approach represents best professional practice because it integrates the principles of psychoanalytic play therapy with a robust risk assessment framework, adhering to the ethical guidelines and legal mandates of the certified play therapist's jurisdiction. This approach acknowledges that while the unconscious is explored through play, the therapist's primary duty of care includes protecting the child. A systematic risk assessment, informed by developmental psychology and the specific manifestations of the child's play, allows for a nuanced understanding of potential dangers. When risk is identified, the therapist can then take appropriate, proportionate steps, which may include consulting with parents, involving other professionals, or making mandatory reports, all while attempting to maintain the therapeutic alliance and the integrity of the psychoanalytic process as much as possible. This aligns with the ethical principle of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm, as well as legal requirements for child protection. An incorrect approach that focuses solely on interpreting the symbolic meaning of aggressive play without a concurrent risk assessment fails to meet the duty of care. This approach is ethically and potentially legally deficient because it prioritizes theoretical exploration over immediate safety. If the aggressive play is indicative of a genuine risk of harm, delaying intervention based on a purely interpretive stance could lead to severe consequences for the child or others. This violates the principle of non-maleficence and may breach mandatory reporting laws if the therapist becomes aware of abuse or neglect. Another incorrect approach that immediately escalates to external reporting or intervention based on any expression of aggression, without a thorough risk assessment, also presents ethical and professional failures. While safety is paramount, premature or disproportionate intervention can be detrimental to the therapeutic process and the child's trust. It may also be an overreach of the therapist's mandate and could unnecessarily involve external agencies, potentially causing undue distress to the child and family. This approach fails to demonstrate the nuanced judgment required in play therapy, where symbolic expression often serves as a safe outlet for difficult emotions. The professional decision-making process for similar situations should involve a continuous cycle of observation, assessment, intervention, and reassessment. The certified play therapist must first be attuned to the nuances of the child's play, looking for patterns, intensity, and themes. This is followed by a formal or informal risk assessment, considering the child's age, developmental stage, the context of the play, and any other relevant information. Based on this assessment, the therapist decides on the most appropriate intervention, which could range from continued observation and interpretation within the play session to consultation with caregivers or mandatory reporting. Crucially, the therapist must document their assessment and decision-making process thoroughly and be prepared to reevaluate the risk as the therapy progresses. This systematic and ethically grounded approach ensures that the child's well-being is prioritized while respecting the therapeutic process. Question 8. The efficiency study reveals that a specific cognitive behavioral play therapy, CBPT, intervention for anxiety in children has shown a statistically significant reduction in reported anxiety symptoms. However, qualitative data indicates that the child experienced increased frustration during sessions and expressed a desire to engage in different play activities, while the therapist maintained high fidelity to the CBPT protocol. Which of the following best represents the most ethically sound and professionally responsible approach to interpreting and reporting these findings? Option A. Report the intervention as effective due to symptom reduction, but recommend discontinuing the specific CBPT protocol and exploring alternative play-based approaches that better align with the child's expressed preferences and emotional state. Option B. Focus solely on the fidelity to the CBPT protocol as the primary indicator of success, assuming that any child distress is a necessary part of the therapeutic process in achieving long-term behavioral change. Option C. Conclude that the intervention was effective based on the significant symptom reduction, while acknowledging the child's expressed frustration as a minor side effect that will likely resolve with continued treatment. Option D. Conclude that the intervention was ineffective because the child's negative subjective experience and resistance to the protocol outweigh the symptom reduction, suggesting a need for a completely different therapeutic modality. Correct answer is C. Conclude that the intervention was effective based on the significant symptom reduction, while acknowledging the child's expressed frustration as a minor side effect that will likely resolve with continued treatment. Explanation. This scenario presents a common challenge in play therapy, balancing the need for evidence-based practice with the individualized nature of child therapy. The certified play therapist must evaluate the efficacy of a specific cognitive behavioral play therapy, CBPT, intervention without compromising the therapeutic alliance or the child's unique needs. The professional challenge lies in discerning whether the observed outcomes are attributable to the fidelity of the CBPT model or to other factors, and how to ethically interpret and report these findings. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted evaluation of the intervention's effectiveness. This involves not only measuring symptom reduction, but also assessing the child's subjective experience, the strength of the therapeutic relationship, and the therapist's adherence to CBPT principles. This aligns with ethical guidelines that mandate evidence-based practice while also emphasizing client welfare and the importance of the therapeutic process. Specifically, it reflects the ethical obligation to provide competent services, which includes ongoing assessment and adaptation of interventions based on client response and best available evidence. The focus on both quantitative and qualitative data ensures a holistic understanding of the intervention's impact, respecting the complexity of child development and therapeutic change. An incorrect approach that focuses solely on symptom reduction without considering the therapeutic alliance or the child's subjective experience fails to meet ethical standards for comprehensive assessment. This could lead to misinterpretations of progress, potentially overlooking the child's distress or the negative impact of the intervention on their engagement. Ethically, this approach neglects the principle of beneficence by not fully understanding the child's overall well-being. Another incorrect approach that prioritizes strict adherence to a manualized CBPT protocol, even when the child is not responding positively, demonstrates a failure to adapt interventions to individual needs, which is a violation of the ethical principle of non-maleficence. Furthermore, it may disregard the importance of the therapeutic relationship, a cornerstone of effective play therapy, potentially leading to premature termination or a breakdown in trust. Professionals should approach such situations by first establishing clear, measurable goals that encompass both symptom reduction and therapeutic process indicators. Should then employ a mixed methods approach to data collection, integrating standardized measures with qualitative observations and client self-report, age appropriately. Regular supervision and consultation with peers are crucial for objective evaluation and to ensure adherence to ethical guidelines and best practices in play therapy. The decision-making process should always center on the child's best interests, informed by both empirical evidence and clinical judgment. Question 9. Regulatory review indicates that a certified play therapist is working in a school setting and observing that a child is struggling to engage with a specific academic concept. The therapist believes that incorporating play-based activities could significantly aid the child's understanding and overall development. The therapist is considering how to best utilize play as a tool for learning and growth in this context. Which of the following approaches best aligns with ethical and professional guidelines for certified play therapists in this situation? Option A. Design and implement play activities that are specifically tailored to address the academic concept, ensuring these activities are integrated into the child's daily routine with the cooperation of educators, and regularly assess the child's progress in both play engagement and understanding of the concept. Option B. Directly instruct the child on the academic concept using traditional teaching methods, and only use play as a supplementary activity if the child shows significant distress or resistance to direct instruction. Option C. Create play scenarios that mirror the academic concept precisely, expecting the child to learn the concept through direct imitation and adult-guided play, without significant consideration for the child's spontaneous exploration or intrinsic motivation. Option D. Focus on using play as a reward for the child's successful completion of academic tasks related to the concept, thereby motivating them through external reinforcement. The correct answer is A. Design and implement play activities that are specifically tailored to address the academic concept, ensuring these activities are integrated into the child's daily routine with the cooperation of educators, and regularly assess the child's progress in both play engagement and understanding of the concept. Explanation. This scenario presents a professional challenge because it requires a play therapist to balance the inherent developmental benefits of play with the specific learning objectives of an educational setting, while also adhering to ethical guidelines regarding client autonomy and informed consent. The therapist must consider how to integrate play-based learning in a way that is developmentally appropriate for the child and aligns with the goals of the educational program without compromising the child's intrinsic motivation or the therapeutic nature of play. Careful judgment is required to ensure that play remains a tool for growth and learning, rather than becoming a purely didactic or prescriptive activity. The correct approach represents best professional practice because it prioritizes the child's developmental needs and therapeutic goals within the context of the educational environment. By collaboratively developing a plan with educators that leverages play as a vehicle for learning and growth, the therapist ensures that the child's experience is holistic and integrated. This approach respects the child's agency and acknowledges the unique contributions of both play therapy and educational instruction. It aligns with ethical principles of beneficence, non-maleficence, and respect for autonomy, ensuring that interventions are in the child's best interest and are implemented with appropriate collaboration and understanding. An incorrect approach that focuses solely on the educational curriculum, disregarding the child's developmental stage and therapeutic needs, fails to uphold the core principles of play therapy. This would be a regulatory and ethical failure, as it prioritizes external learning objectives over the child's well-being and intrinsic developmental process. Another incorrect approach that uses play solely as a reward or punishment mechanism for academic performance is also a significant ethical violation. This instrumentalizes play, undermining its therapeutic value and potentially creating negative associations with both play and learning. It disregards the child's emotional and psychological needs, which are central to play therapy. A third incorrect approach that involves imposing adult-defined learning outcomes onto play without considering the child's spontaneous engagement and exploration would be a failure to respect the child's autonomy and the natural learning processes inherent in play. This approach risks turning play into a chore, hindering genuine growth and learning. Professionals should employ a decision-making framework that begins with a thorough assessment of the child's developmental needs and therapeutic goals. This should be followed by collaborative consultation with educators to understand the learning environment and objectives. The therapist then designs play-based interventions that are developmentally appropriate, intrinsically motivating for the child, and supportive of both therapeutic progress and educational goals. Ongoing evaluation of the child's engagement and progress, with adjustments made as needed, is crucial. This iterative process ensures that play remains a powerful tool for learning and growth, ethically and effectively integrated into the child's life. Question 10. The efficiency study reveals that a play therapist is assessing a child's therapeutic progress. The child has been exhibiting significant anxiety related to a recent family upheaval. The therapist observes the child engaging in repetitive actions with toys, then in building complex structures, and finally in using toys to represent characters and scenarios. Which type of play is most likely to provide the deepest insight into the child's processing of their anxiety and emotional state in this context? Option A, constructive play. Option B, observational play. Option C, functional play. Option D, symbolic play. Correct answer is D, symbolic play. Explanation. This scenario presents a professional challenge because it requires a play therapist to move beyond simply observing play to actively assessing its therapeutic efficacy through a structured lens. The therapist must discern which type of play is most indicative of progress for a child experiencing specific emotional difficulties, necessitating a nuanced understanding of developmental psychology and therapeutic goals. The challenge lies in accurately interpreting the child's engagement and linking it to observable therapeutic outcomes, rather than making assumptions based on superficial play behaviors. The correct approach represents best professional practice because it aligns with the core principles of play therapy, which emphasize the child's natural language of play to facilitate healing. By focusing on symbolic play, the therapist is engaging with the child's internal world, where emotions and experiences are processed and expressed through representation. This approach is ethically sound as it prioritizes the child's agency and the depth of their therapeutic work, adhering to guidelines that advocate for interventions that address the root causes of distress. Regulatory frameworks for play therapy typically mandate that practitioners utilize evidence-informed approaches that respect the child's developmental stage and therapeutic needs. An incorrect approach that focuses solely on functional play, such as repetitive stacking of blocks without variation, would be professionally unacceptable. This failure would stem from a misunderstanding of therapeutic progression. While functional play is a foundational stage, it may not always indicate deeper emotional processing or resolution. Ethically, it could lead to misinterpreting a child's developmental plateau as therapeutic success, or, conversely, overlooking signs of distress that are being expressed symbolically. Regulatory failure would occur if this limited observation led to an inappropriate assessment of the child's progress or a deviation from established therapeutic protocols for addressing complex emotional issues. Another incorrect approach, fixating on constructive play like building elaborate structures, might also be professionally problematic. While constructive play can be a sign of cognitive development and problem-solving, it may not directly address the underlying emotional conflicts the child is working through. An ethical failure would arise if the therapist prioritized the observable product of play over the child's internal experience and emotional expression. This could lead to a superficial assessment of therapeutic gains, failing to acknowledge the deeper emotional work that symbolic play often facilitates. Regulatory noncompliance would be evident if such a narrow focus led to an inaccurate treatment plan or an inadequate evaluation of therapeutic outcomes, potentially contravening standards for comprehensive child assessment. The professional decision-making process for similar situations should involve a continuous cycle of observation, hypothesis generation, and assessment. Therapists must first understand the specific therapeutic goals for the child and the developmental appropriateness of different play types. They should then observe the child's engagement across various play modalities, looking for patterns and shifts. Crucially, they must interpret these observations within the context of the child's presenting issues and therapeutic progress, consulting relevant literature and ethical guidelines. If there is uncertainty, seeking supervision or consultation with experienced colleagues is a vital step in ensuring best practice and ethical adherence. Question 11. The risk matrix shows that while play is a fundamental tool for child development, certain play behaviors can present complex therapeutic challenges. A certified play therapist is working with a child who is engaging in repetitive, aggressive play involving toy figures. The therapist needs to decide how to respond. Which of the following approaches best reflects the role of play in child development within the regulatory framework for certified play therapists? Option A. Observe the play closely, seeking to understand the underlying emotions and themes the child is expressing, and consider how this play serves as a developmental process for the child, adapting interventions as needed. Option B. Immediately intervene to redirect the child's play towards more constructive and less aggressive themes to ensure a safe and positive therapeutic environment. Option C. Allow the aggressive play to continue unchecked, assuming that all forms of play are inherently beneficial for development and require no therapeutic guidance. Option D. Limit the child's access to aggressive toys and materials to prevent the reinforcement of violent themes in their play. The correct answer is A. Observe the play closely, seeking to understand the underlying emotions and themes the child is expressing, and consider how this play serves as a developmental process for the child, adapting interventions as needed. Explanation. Scenario analysis. This scenario presents a common challenge for certified play therapists, balancing the inherent developmental benefits of play with potential risks that may arise during therapeutic play. The therapist must discern when a child's play is indicative of healthy processing and when it signals a need for intervention or a shift in therapeutic strategy. This requires a deep understanding of child development, play theory, and ethical practice, all within the specific regulatory framework governing certified play therapists. The challenge lies in accurately interpreting the nuances of play behavior and making informed decisions that prioritize the child's well-being and therapeutic progress. Correct approach analysis. The correct approach emphasizes the therapist's responsibility to observe, assess, and adapt their interventions based on the child's developmental stage and the meaning embedded in their play. This aligns with the core principles of play therapy, which posits that play is a child's natural language and a primary means of processing experiences, developing coping skills, and fostering emotional regulation. A certified play therapist is ethically and regulatorily bound to utilize play as a therapeutic tool, understanding its developmental significance. This approach demonstrates a commitment to evidence-based practice and client-centered care, ensuring that the therapeutic environment supports the child's growth and healing through developmentally appropriate play. Incorrect approaches analysis. An approach that focuses solely on limiting or redirecting play without understanding its underlying meaning or developmental purpose fails to leverage the therapeutic potential of play. This could be a regulatory or ethical failure if it impedes the child's natural processing or expression, potentially violating guidelines that mandate the use of developmentally appropriate interventions. An approach that ignores potentially concerning themes within the child's play, assuming all play is inherently beneficial, is also problematic. This could lead to a failure to identify and address significant distress or trauma, which would be a breach of the therapist's duty of care, and potentially violate ethical codes requiring proactive intervention when a child's safety or well-being is at risk. An approach that prioritizes the therapist's personal comfort or preconceived notions about appropriate play over the child's therapeutic needs disregards the fundamental principles of play therapy and ethical practice. This could lead to a failure to provide effective treatment and may contravene regulatory standards that emphasize client autonomy and the therapist's role in facilitating the child's unique therapeutic journey. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the child's developmental stage and presenting concerns. This is followed by careful observation of the child's play, seeking to understand the symbolic meaning and emotional content. The therapist then integrates this understanding with theoretical knowledge of child development and play therapy principles to formulate and adapt interventions. This iterative process ensures that therapeutic decisions are grounded in the child's needs and the dynamic nature of the therapeutic process, adhering to ethical guidelines and regulatory requirements for competent practice. Question 12. Implementation of a play therapy approach for a 7-year-old experiencing anxiety following a parental separation requires careful consideration of theoretical integration. The therapist observes the child frequently engaging in elaborate fantasy play involving superheroes defending their homes from monsters, alongside a tendency to withdraw and become nonverbal when discussing feelings directly. Which of the following approaches best reflects a sophisticated and ethically grounded integration of theoretical frameworks for this client? Option A. Adopting a purely humanistic approach, emphasizing unconditional positive regard and allowing the child to lead the play without specific interventions aimed at processing the separation anxiety. Option B, integrating elements of psychodynamic theory to explore the symbolic meaning of the superhero and monster play, while utilizing attachment-based interventions to foster a secure therapeutic relationship and address the child's anxieties related to separation and potential abandonment. Option C, primarily employing a behavioral approach, focusing on reinforcing positive coping mechanisms for anxiety and systematically desensitizing the child to triggers associated with the separation. Option D, focusing exclusively on a cognitive behavioral framework, teaching the child specific thought-stopping techniques to manage anxious thoughts and encouraging them to reframe their perceptions of the separation. The correct answer is B, integrating elements of psychodynamic theory to explore the symbolic meaning of the superhero and monster play, while utilizing attachment-based interventions to foster a secure therapeutic relationship and address the child's anxieties related to separation and potential abandonment. Explanation: this scenario presents a common professional challenge for certified play therapists, integrating multiple theoretical orientations to best serve a child client. The challenge lies in ensuring that the integration is coherent, ethically sound, and aligned with the client's evolving needs, rather than a haphazard application of techniques. Careful judgment is required to select and blend approaches that are mutually supportive and avoid conflicting messages to the child. The correct approach represents best professional practice because it demonstrates a thoughtful, client-centered integration of theoretical frameworks. This involves a deep understanding of how different theories inform play therapy interventions and how they can be woven together to create a comprehensive treatment plan. It prioritizes the child's unique developmental stage, presenting issues and relational patterns, selecting elements from various theories that best address these specific factors. This approach is ethically grounded in the principle of beneficence, aiming to maximize the child's well-being by utilizing the most effective and appropriate therapeutic tools. It also reflects a commitment to ongoing professional development and a nuanced understanding of play therapy's diverse theoretical landscape, aligning with the ethical guidelines of the Certified Play Therapist credential, which emphasizes competence and client welfare. An incorrect approach that relies solely on one theoretical model without considering the child's specific needs would be professionally unacceptable. This failure stems from a lack of flexibility and a potential misapplication of a single framework when other approaches might be more beneficial. It could lead to a treatment that is not fully responsive to the child's presenting problems or developmental stage, potentially hindering progress and not upholding the ethical obligation to provide the most effective care. Another incorrect approach would be to randomly select techniques from various theories, without a unifying rationale or understanding of their theoretical underpinnings. This eclectic approach, when not grounded in a coherent theoretical integration, can be confusing for the child and therapist alike. It risks superficial application of techniques without addressing the core issues, violating the ethical principle of competence, and potentially causing harm by offering ineffective interventions. This also fails to demonstrate the depth of understanding required for a certified play therapist. A further incorrect approach might involve prioritizing the therapist's personal preference for a particular theoretical model over the client's needs. This is a significant ethical failure, as it places the therapist's agenda above the child's well-being. It demonstrates a lack of objectivity and a failure to adapt therapeutic strategies to the individual client, which is a cornerstone of ethical and effective play therapy practice. The professional decision-making process for similar situations should involve a thorough assessment of the child's presenting issues, developmental level, family dynamics, and cultural context. This assessment should then inform the selection and integration of theoretical approaches. Therapists should ask themselves, which theoretical lenses best help me understand this child's experience and behavior? And how can I combine interventions from different theories in a way that is cohesive and mutually reinforcing for this specific child? Regular supervision and consultation with peers are also crucial for ensuring that the integrated approach remains client-centered, ethically sound, and therapeutically effective. Question 13. Benchmark analysis indicates that a certified play therapist is working with a child who has disclosed fragmented experiences of neglect and witnessing domestic violence during play sessions. The child has begun to exhibit increased anxiety and somatic complaints. The therapist has documented these disclosures and behavioral changes. What is the most ethically and legally sound course of action for the certified play therapist in this situation? Option A. Continue to explore the child's experiences solely through play, focusing on building trust and hoping the child will disclose more without external intervention. Option B. Confront the child's parents directly with the specific details of the child's disclosures to encourage them to seek help. Option C. Advise the child that these disclosures are concerning, but suggest they are likely a result of imagination and not to worry about them. Option D. Immediately report the disclosures and concerns to the appropriate Child Protective Services agency, following established protocols for suspected child abuse or neglect. The correct answer is D. Immediately report the disclosures and concerns to the appropriate Child Protective Services agency, following established protocols for suspected child abuse or neglect. Explanation: scenario analysis. This scenario presents a professional challenge due to the intersection of a child's developmental needs, the impact of adverse childhood experiences, ACE, and the ethical imperative to protect client confidentiality, while also ensuring child safety. The play therapist must navigate the complex task of gathering information about potential abuse or neglect without compromising the therapeutic relationship or violating legal reporting obligations. The child's disclosure, even if fragmented, triggers a duty of care that requires careful consideration of the most appropriate and legally sound response. Correct approach analysis. The correct approach prioritizes the child's immediate safety and well-being by following established reporting protocols for suspected child abuse or neglect. This aligns with the ethical codes of play therapy, which mandate reporting when there is a reasonable suspicion of harm to a child. Furthermore, it adheres to legal mandates in most jurisdictions that require mandated reporters, including play therapists, report such concerns to the appropriate authorities. This approach upholds the principle of do no harm by taking proactive steps to protect the child from further victimization and ensures compliance with legal and ethical standards. Incorrect approaches analysis. One incorrect approach involves solely focusing on the child's comfort and continuing the play session without taking further action. This fails to acknowledge the potential severity of the ACEs disclosed and the therapist's legal and ethical obligation to report. It risks allowing a dangerous situation to continue unaddressed, potentially leading to further harm to the child. This approach violates the duty to protect and the principles of beneficence and non-maleficence. Another incorrect approach is to immediately confront the parents with the child's statements without first consulting with supervisors or relevant authorities. Transparency is often valued. In cases of suspected abuse, this can jeopardize the investigation, put the child at further risk, and potentially violate confidentiality rules regarding reporting. It bypasses the established procedures designed to protect both the child and the integrity of the reporting process. This approach may also be seen as a failure to exercise due diligence and professional judgment in a sensitive situation. A third incorrect approach is to dismiss the child's statements as mere fantasy or imaginative play without further investigation. ACEs can manifest in complex ways, and children may use play to express trauma they cannot articulate directly. Dismissing these disclosures without careful consideration can lead to missed opportunities to intervene and protect a child in need. This demonstrates a lack of understanding of how trauma impacts child development and play, and a failure to adhere to the principle of taking all disclosures seriously. Professional reasoning. Professionals should employ a decision-making framework that begins with recognizing the potential impact of ACEs on a child's behavior and disclosures. This involves understanding the therapist's role as a mandated reporter and the legal and ethical boundaries of confidentiality. When a disclosure raises concerns about child safety, the immediate steps should include consulting with supervisors or experienced colleagues, reviewing relevant professional codes of ethics and legal statutes, and then proceeding with reporting to the appropriate Child Protective Services or law enforcement agency. This systematic approach ensures that the child's safety is paramount while maintaining professional integrity and legal compliance. Question 14. The evaluation methodology shows a certified play therapist is working with a child experiencing significant anxiety and withdrawal following a family relocation. The therapist has received training in psychodynamic, cognitive behavioral, and humanistic play therapy approaches. Which of the following strategies best reflects an ethically and therapeutically sound implementation of eclectic techniques in this scenario. Option A. Primarily utilizing techniques from the modality the therapist feels most comfortable with, occasionally incorporating a few techniques from other approaches if the child appears resistant to the primary method. Option B. Randomly selecting and applying play therapy techniques from various theoretical orientations as they come to mind during sessions, without a consistent underlying rationale or assessment-driven integration. Option C. Focusing exclusively on cognitive behavioral techniques to directly address the child's anxious thoughts and behaviors, disregarding other modalities that might offer different avenues for emotional processing. Option D. Systematically integrating specific techniques from each modality based on a comprehensive assessment of the child's needs, developmental stage, and responsiveness, ensuring a cohesive therapeutic process aimed at reducing anxiety and fostering adaptation. The correct answer is D. Systematically integrating specific techniques from each modality based on a comprehensive assessment of the child's needs, developmental stage, and responsiveness, ensuring a cohesive therapeutic process aimed at reducing anxiety and fostering adaptation. Explanation: the evaluation methodology shows a certified play therapist is assessing a child exhibiting symptoms of anxiety and withdrawal following a family relocation. The therapist has been trained in multiple play therapy modalities, including psychodynamic, cognitive behavioral, and humanistic approaches. The challenge lies in selecting and integrating techniques from these diverse frameworks in a manner that is both ethically sound and maximally beneficial for the child, without compromising the integrity of any single modality or the overall therapeutic process. This requires a deep understanding of each theoretical orientation's core principles, its applicability to the child's specific developmental stage and presenting issues, and the potential for synergistic or conflicting effects when combined. The correct approach represents best professional practice because it prioritizes a client-centered, developmentally appropriate, and theoretically integrated application of eclectic techniques. This involves a thorough assessment to identify the child's unique needs, strengths, and preferred play styles. The therapist then judiciously selects and adapts techniques from various modalities that are most likely to address the child's anxiety and withdrawal, while maintaining a cohesive therapeutic narrative. This integration is guided by the overarching goal of fostering the child's emotional regulation, coping skills, and sense of security in their new environment. This approach aligns with ethical guidelines that mandate competence, beneficence, and non-maleficence, ensuring that the child's well-being is paramount and that interventions are evidence-informed and tailored to the individual. An incorrect approach would be to haphazardly apply techniques from different modalities without a clear rationale or theoretical grounding. For instance, randomly switching between techniques without considering their underlying principles or potential impact on the child's therapeutic alliance could lead to confusion, fragmentation of the therapeutic process, and a failure to effectively address the presenting issues. This could be considered a failure to maintain competence and to act in the child's best interest, potentially violating ethical principles of beneficence and non-maleficence. Another incorrect approach might be to rigidly adhere to one modality, ignoring the child's responsiveness or the potential benefits of techniques from other frameworks, which would also be a failure to adapt interventions to the client's needs and could hinder therapeutic progress. The professional decision-making process for similar situations involves a cyclical approach: thorough assessment, theoretical formulation, intervention planning, including selection and integration of techniques, implementation, ongoing evaluation of the child's progress, and adjustment of the intervention plan as needed. This process is informed by the therapist's knowledge of various play therapy models, their understanding of child development, and their ethical obligations to the client. It requires critical thinking, flexibility, and a commitment to continuous learning and self-reflection. Question 15. Governance review demonstrates that a certified play therapist is working with a child exhibiting repetitive play patterns involving sorting and organizing small objects. The therapist is considering how to interpret these behaviors in light of established child development theories. Which of the following approaches best guides the therapist's assessment and intervention planning? Option A. Assume that any repetitive play behavior in young children is a normal developmental phase and requires no specific therapeutic intervention beyond general supervision. Option B. Interpret the repetitive sorting and organizing play as a direct and immediate indicator of obsessive-compulsive disorder, necessitating a referral for psychiatric evaluation without further play-based assessment. Option C. Prioritize a comprehensive understanding of the child's developmental stage, considering multiple theoretical perspectives on play and development, and observe how the repetitive behaviors align with or deviate from typical patterns for their age and context. Option D. Focus exclusively on the child's verbalizations during play, disregarding the symbolic meaning or developmental significance of the repetitive actions themselves. Correct answer is C. Prioritize a comprehensive understanding of the child's developmental stage, considering multiple theoretical perspectives on play and development, and observe how the repetitive behaviors align with or deviate from typical patterns for their age and context. Explanation. This scenario presents a professional challenge due to the inherent variability in child development and the nuanced nature of play as a therapeutic tool. A certified play therapist must navigate the ethical imperative to provide individualized care while adhering to established developmental frameworks and ensuring client safety and efficacy. The challenge lies in discerning when a child's play behavior, while potentially indicative of distress, also aligns with typical developmental stages, requiring a different therapeutic response than if it were a clear deviation. Careful judgment is required to avoid misinterpreting developmental milestones as pathological or, conversely, underestimating the significance of play behaviors that signal deeper issues. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of child development, integrating theoretical knowledge with direct observation of the child's play. This approach aligns with the ethical guidelines of play therapy, which emphasize the importance of tailoring interventions to the child's unique developmental level, emotional state, and presenting concerns. By considering multiple developmental theories and observing the child's play in context, the therapist can make a more accurate assessment and develop a more effective treatment plan. This respects the child's autonomy and promotes therapeutic progress by meeting them where they are developmentally. An incorrect approach that focuses solely on a single developmental theory, without considering the child's individual presentation or the broader context of their play, would be professionally unacceptable. This could lead to misdiagnosis or the implementation of inappropriate interventions, potentially hindering the child's progress or even causing harm. Similarly, an approach that dismisses play behaviors as simply acting out, without exploring the underlying emotional meaning or developmental significance, would fail to utilize the core principles of play therapy. This overlooks the diagnostic and therapeutic power of play. Another incorrect approach might be to rely solely on parental reports without direct observation of the child's play, which can lead to a skewed understanding of the child's internal world and therapeutic needs. The professional decision-making process for similar situations should involve a cyclical approach. Observe the child's play, hypothesize based on developmental theories and clinical presentation. Assess the validity of the hypothesis through further observation and potentially consultation, and then refine the intervention. This process requires continuous self-reflection, a commitment to ongoing professional development in child development and play therapy, and a strong adherence to ethical codes that mandate competence, beneficence, and non-maleficence. Question 16. Investigation of how a certified play therapist should ethically and effectively utilize the Play Therapy Diagnostic Inventory, PTDI, when a child's play themes appear to diverge from the standardized scoring categories, considering the need to balance objective assessment with the subjective experience of play. Option A. Integrate the PTDI findings with detailed observations of the child's play, noting any discrepancies and exploring these through further therapeutic play to form a comprehensive understanding that informs treatment. Option B. Exclusively rely on the PTDI numerical scores to determine the child's diagnosis and treatment plan, as this provides objective data that supersedes subjective play observations. Option C. Use the PTDI to definitively label the child based on the initial scores, and then tailor the play therapy interventions to directly address these labels without further exploration of the child's unique play narrative. Option D. Disregard the PTDI entirely, as its structured format is incompatible with the fluid and expressive nature of play therapy, and rely solely on emergent themes in the playroom. Correct answer is A. Integrate the PTDI findings with detailed observations of the child's play, noting any discrepancies and exploring these through further therapeutic play to form a comprehensive understanding that informs treatment. Explanation. This scenario presents a professional challenge because it requires a play therapist to navigate the ethical and practical considerations of using a standardized assessment tool, the Play Therapy Diagnostic Inventory, PTDI, in a way that is both clinically sound and respects the client's evolving needs. The challenge lies in balancing the desire for objective data with the inherently dynamic and often nonverbal nature of play therapy. Careful judgment is required to ensure the PTDI is used as a supportive tool rather than a rigid diagnostic straitjacket, especially when the child's presentation may not fit neatly into predefined categories. The correct approach represents best professional practice because it prioritizes the child's well-being and the therapeutic relationship. By integrating the PTDI findings with ongoing clinical observation and the child's unique play themes, the therapist demonstrates a commitment to a holistic understanding of the child. This aligns with ethical guidelines that emphasize individualized treatment and the use of assessment tools in a manner that enhances, rather than dictates, therapeutic direction. The therapist is acting as a responsible practitioner by using the PTDI as one piece of a larger diagnostic puzzle, ensuring that the child's narrative and experience remain central to the therapeutic process. This approach respects the limitations of any single assessment tool and underscores the importance of clinical judgment informed by direct experience with the child. An incorrect approach that relies solely on the PTDI numerical scores without considering the child's play behavior would be a significant regulatory and ethical failure. This would violate the principle of individualized care, potentially leading to misdiagnosis or inappropriate treatment planning. It would also fail to acknowledge the qualitative data inherent in play therapy, which is crucial for understanding the child's internal world. Another incorrect approach, such as disregarding the PTDI entirely due to a perceived conflict with play therapy principles, would be a failure to utilize a potentially valuable tool for objective data collection and communication with other professionals. This could hinder collaborative care and limit the therapist's ability to articulate the child's progress in a standardized manner. A third incorrect approach, using the PTDI to label the child without further exploration, would be a direct violation of ethical codes that prohibit stigmatization and emphasize the importance of understanding the underlying causes of behavior. Professionals should employ a decision-making process that begins with understanding the purpose and limitations of any assessment tool, including the PTDI. This involves considering how the tool can best serve the client's needs and how its findings can be integrated with other sources of information. A critical step is to always prioritize the client's narrative and the therapeutic relationship, using assessment data to inform, not replace, clinical judgment. When faced with ambiguous or conflicting data, professionals should engage in consultation with supervisors or peers and remain open to reevaluating their understanding of the client's presentation. The ultimate goal is to ensure that all interventions are client-centered, ethically sound, and contribute to the child's well-being. Question 17. What factors determine the appropriate application of Freudian concepts of psychosexual development and defense mechanisms within play therapy sessions for a child, ensuring adherence to ethical practice and regulatory guidelines for certified play therapists? Option A. The direct verbalization of unconscious desires by the child during play, allowing for immediate interpretation of Freudian complexes without further therapeutic exploration. Option B. The child's current developmental stage, the specific play behaviors observed, the therapeutic alliance, and the therapist's professional judgment in integrating theoretical understanding with client-centered needs. Option C. The consistent and exclusive use of Freudian terminology to explain all observed play behaviors, reinforcing the theoretical framework as the sole determinant of the child's psychological state. Option D. The therapist's personal familiarity with Freudian literature and their ability to identify classic Freudian symbols within the child's play, regardless of the child's age or context. The correct answer is B. The child's current developmental stage, the specific play behaviors observed, the therapeutic alliance, and the therapist's professional judgment in integrating theoretical understanding with client-centered needs. Explanation. This scenario is professionally challenging because a certified play therapist must apply theoretical frameworks, such as Freud's theory of play, in a way that is both developmentally appropriate for the child and ethically sound, while also adhering to the specific regulatory framework governing their practice. The therapist needs to move beyond a purely academic understanding of Freud's concepts and translate them into actionable interventions that respect the child's autonomy and the therapeutic relationship. Careful judgment is required to avoid misinterpreting play behaviors through a rigid Freudian lens, which could lead to inappropriate interventions or a failure to recognize other significant developmental influences. The correct approach represents best professional practice because it prioritizes the child's immediate therapeutic needs and developmental stage, integrating Freudian concepts as a lens for understanding rather than a prescriptive set of rules. This approach aligns with ethical guidelines that emphasize client-centered care, informed consent, where applicable, and the therapist's responsibility to use theoretical knowledge judiciously. It acknowledges that play is a complex phenomenon with multiple contributing factors, and that a rigid adherence to any single theory, including Freudian psychoanalysis, may not always be the most effective or ethical path. The therapist's ability to adapt theoretical understanding to the unique context of each child is paramount. An incorrect approach that focuses solely on identifying Oedipal or electrocomplex manifestations in a young child's play, without considering the child's age, developmental stage, or other potential interpretations, represents a significant ethical failure. This rigid application of Freudian theory can lead to misdiagnosis, inappropriate therapeutic goals, and potentially harmful interpretations of the child's behavior. It violates the principle of beneficence by failing to act in the child's best interest, and could be seen as a breach of professional competence if the therapist lacks the skill to differentiate between Freudian interpretations and other valid developmental explanations. Furthermore, it may disregard the regulatory requirement to practice within one's scope of competence and to use evidence-based or theoretically sound approaches that are appropriate for the client. Another incorrect approach that involves directly interpreting a child's play as a literal representation of unconscious desires without any mediating therapeutic process or consideration for the child's understanding would also be ethically problematic. This bypasses the crucial role of the therapeutic relationship and the gradual unfolding of meaning in play therapy. It could be seen as a violation of the child's privacy and a failure to establish a safe and trusting therapeutic environment. Ethically, it risks imposing the therapist's agenda onto the child's play, rather than facilitating the child's own exploration and expression. The professional decision-making process for similar situations should involve a continuous cycle of assessment, theoretical integration, intervention, and evaluation. The therapist must first assess the child's presenting issues and developmental stage. Then, they should consider relevant theoretical frameworks, including Freudian theory, as potential lenses for understanding, but not as definitive explanations. The therapist must critically evaluate how these theories apply to the specific child and situation, always prioritizing the child's well-being and the therapeutic alliance. Interventions should be chosen based on their appropriateness for the child's age and developmental level, and their potential to facilitate growth and healing. Finally, the therapist must continually evaluate the effectiveness of their interventions and be prepared to adjust their approach based on the child's responses and evolving needs, always in alignment with ethical codes and regulatory requirements. Question 18. When evaluating a child's engagement in a play scenario involving a dollhouse and figurines, which approach best aligns with the principles of developmental play therapy and the regulatory framework for certified play therapists? Option A. Focusing on correcting any perceived inappropriate behaviors within the play, such as aggressive interactions between figurines, by redirecting the child to more structured activities. Option B. Introducing new, complex play materials that are designed for older children to challenge the child's cognitive abilities. Option C. Observing the child's interactions, noting the themes and emotional expressions conveyed through the play, and responding with reflective comments that validate the child's experience without imposing interpretations. Option D. Directly asking the child to verbally explain the narrative of their play and the feelings associated with each figurine's actions. The correct answer is C. Observing the child's interactions, noting the themes and emotional expressions conveyed through the play, and responding with reflective comments that validate the child's experience without imposing interpretations. Explanation. This scenario presents a professional challenge because it requires a certified play therapist to navigate the ethical and developmental considerations of a child's play while adhering to specific regulatory frameworks governing therapeutic practice. The core of the challenge lies in interpreting a child's spontaneous play, which is inherently symbolic and can reveal complex emotional states, and then deciding on the most appropriate therapeutic intervention without overstepping professional boundaries or misinterpreting the child's communication. The therapist must balance the child's right to self-expression through play with the need for a structured, evidence-based therapeutic approach that aligns with professional standards and client welfare. The correct approach represents best professional practice because it prioritizes the child's developmental stage and utilizes play as the primary modality for assessment and intervention, consistent with the principles of developmental play therapy. This approach acknowledges that children communicate and process experiences through play, and that a therapist's role is to facilitate this process in a safe and supportive environment. Adherence to the specific regulatory framework for certified play therapists ensures that interventions are evidence-based, ethically sound, and focused on the child's well-being, respecting their autonomy and developmental needs. This involves careful observation, attunement to the child's cues, and the use of therapeutic play techniques that are age-appropriate and responsive to the child's unique presentation. An incorrect approach that involves prematurely imposing adult-like verbal interpretations on a child's play fails to respect the child's developmental capacity for symbolic expression. This can lead to misinterpretation, alienate the child, and potentially cause distress by forcing cognitive understanding before the child is ready. Ethically, it violates the principle of respecting the child's developmental level and their right to communicate in their own language play. Another incorrect approach, such as focusing solely on external behavioral management without exploring the underlying emotional dynamics revealed in play, neglects the core tenets of play therapy. This approach risks treating symptoms rather than causes and fails to leverage the powerful therapeutic potential of play for emotional processing and healing. It may also contravene regulatory guidelines that mandate a holistic, child-centered approach that addresses the child's internal world. A further incorrect approach, such as introducing complex cognitive tasks or abstract concepts that are beyond the child's developmental grasp, is inappropriate for developmental play therapy. This can lead to frustration, a sense of failure, and can hinder the therapeutic process. It disregards the foundational principle of meeting the child where they are developmentally and using play as the vehicle for therapeutic change. The professional decision-making process for similar situations should involve a systematic evaluation of the child's developmental stage, the presenting concerns, and the therapeutic goals. The certified play therapist must continuously assess the child's engagement with play, their emotional responses, and the symbolic meaning embedded within their play. This requires ongoing supervision, consultation with peers, and a commitment to staying abreast of current research and best practices in developmental play therapy, all within the confines of the specified regulatory framework. The therapist must remain attuned to the child's pace and lead, using their expertise to facilitate insight and healing through the medium of play. Question 19. Benchmark analysis indicates that a certified play therapist is working with a young child exhibiting significant anxiety and disruptive behaviors at home and school. The parents are seeking strategies to help their child manage these challenges through play therapy. Considering the principles of behavioral interventions within play therapy, which of the following approaches best reflects a developmentally appropriate and ethically sound practice for this certified play therapist? Option A. Introduce a series of pre-designed play activities aimed at teaching social skills and emotional regulation, assuming these general interventions will address the child's anxiety and disruptive behaviors without specific tailoring to the child's unique play style or parental concerns. Option B. Focus on a single, highly researched behavioral technique, such as systematic desensitization, applied directly to the child's reported anxieties during play without further assessment of play themes or parental input on specific goals. Option C. Conduct a thorough assessment of the child's play, family dynamics, and presenting issues. Collaboratively establish specific, measurable goals with the parents, and then select and integrate developmentally appropriate behavioral interventions within the play therapy framework that are responsive to the child's symbolic communication. Option D. Implement a structured token economy system within the play sessions, rewarding specific desired behaviors observed during play, and provide parents with a simplified version to use at home. Correct answer is D. Implement a structured token economy system within the play sessions, rewarding specific desired behaviors observed during play, and provide parents with a simplified version to use at home. Explanation. This scenario presents a professional challenge due to the inherent complexity of tailoring behavioral interventions in play therapy to meet the unique needs of a child, while adhering to ethical guidelines and regulatory frameworks. The play therapist must balance the child's developmental stage, presenting issues, and the family's goals with evidence-based practices and professional competence. Careful judgment is required to select interventions that are not only effective, but also developmentally appropriate and ethically sound, ensuring the child's well-being and the integrity of the therapeutic process. The correct approach represents best professional practice because it prioritizes a comprehensive assessment and collaborative goal setting with the parents. This aligns with ethical principles of informed consent and shared decision-making, ensuring that interventions are tailored to the child's specific needs and family context. Regulatory frameworks for play therapy, such as those outlined by professional bodies like the Association for Play Therapy, APT, in the U.S., emphasize the importance of a thorough diagnostic process and the development of a treatment plan that is individualized and evidence-informed. This approach ensures that behavioral interventions are not applied in a vacuum, but are integrated into a holistic therapeutic plan, respecting the child's autonomy within the play environment and the parent's role as primary caregivers. An incorrect approach that relies solely on a single, unproven behavioral technique without adequate assessment or parental involvement fails to meet professional standards. This could lead to ineffective treatment, potential harm to the child, and a breach of ethical obligations. Specifically, it violates the principle of beneficence by not ensuring the intervention is truly beneficial, and the principle of non-maleficence by risking harm through an inappropriate application. Furthermore, it disregards the importance of parental consent and collaboration, which are often mandated by ethical codes and may be implicitly or explicitly required by state licensing boards for therapists working with minors. Another incorrect approach that focuses on generalized behavioral strategies without considering the child's specific play patterns and symbolic communication overlooks the core tenets of play therapy. Play is the child's language, and effective behavioral interventions in this context must be embedded within the child's natural mode of expression. Failing to do so can result in interventions that are perceived as intrusive or irrelevant by the child, hindering therapeutic progress and potentially alienating the child from the therapeutic process. This approach also risks misinterpreting the child's play, leading to an inaccurate understanding of their internal world and the development of inappropriate interventions. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Conduct a thorough evaluation of the child's developmental history, presenting concerns, family dynamics, and the child's play behaviors. 2. Collaborative goal setting. Engage parents or guardians in defining clear, measurable, and achievable therapeutic goals. 3. Evidence-based intervention selection. Choose behavioral interventions that are supported by research and are appropriate for the child's age, developmental stage, and specific issues. 4. Integration with play therapy principles. Ensure that chosen interventions are integrated seamlessly into the play therapy process, respecting the child's autonomy and using play as the primary medium. 5. Ongoing monitoring and adaptation. Continuously assess the effectiveness of interventions and be prepared to modify the treatment plan based on the child's progress and evolving needs. 6. Ethical and regulatory adherence. Throughout the process, ensure all actions comply with relevant ethical codes and legal regulations governing the practice of play therapy. Question 20. Cost-benefit analysis shows that investing in play-based interventions that foster a child's natural coping mechanisms and self-regulation, rather than solely focusing on immediate symptom suppression, leads to more sustainable resilience and recovery. Considering this, which of the following approaches best aligns with the principles of certified play therapy in supporting a child's journey through adversity? Option A. Encouraging extensive verbal processing of traumatic events within the play setting, even for younger children, to ensure all aspects of the experience are articulated. Option B. Delaying significant play-based interventions until the child's distress becomes more pronounced and clearly identifiable through observable behaviors. Option C. Implementing directive play techniques aimed at quickly resolving overt signs of distress, even if it means guiding the child's play narrative more explicitly. Option D. Prioritizing the creation of a safe, child-led play environment that allows the child to explore their experiences and emotions at their own pace, thereby facilitating the development of intrinsic coping strategies. Correct answer is D. Prioritizing the creation of a safe, child-led play environment that allows the child to explore their experiences and emotions at their own pace, thereby facilitating the development of intrinsic coping strategies. Explanation: this scenario presents a professional challenge because it requires a play therapist to balance the immediate need for intervention with the long-term goal of fostering a child's inherent resilience. The cost-benefit analysis, while not strictly mathematical in this context, implies a consideration of resource allocation and the most effective use of therapeutic time and techniques to achieve optimal outcomes. The core of the challenge lies in identifying when to directly address a child's distress and when to facilitate their natural coping mechanisms through play, ensuring that interventions empower rather than overwhelm. The correct approach represents best professional practice because it prioritizes the child's agency and developmental trajectory. By focusing on creating a safe and supportive play environment, the therapist facilitates the child's exploration of their experiences and emotions at their own pace. This aligns with ethical guidelines that emphasize client-centered care and the principle of do no harm, by avoiding premature or overly directive interventions that could inadvertently pathologize normal responses to adversity or hinder the development of self-efficacy. The emphasis on play as a vehicle for processing trauma and building coping skills is a cornerstone of certified play therapy practice, promoting long-term recovery and resilience. An incorrect approach that focuses solely on immediate symptom reduction through directive play techniques fails to acknowledge the developmental needs of the child and the importance of self-discovery. This could lead to a superficial resolution of distress without addressing underlying issues, potentially hindering the development of robust coping mechanisms. Ethically, this approach might be seen as overly interventionist, not fully respecting the child's pace and internal resources, and could be considered a failure to adhere to best practices in play therapy which advocate for a more organic and child-led process. Another incorrect approach that involves delaying play-based interventions until the child exhibits more overt signs of distress overlooks the preventative and proactive power of play. This could result in missed opportunities to support the child during critical developmental windows and may allow distress to become more entrenched, making recovery more challenging. From a regulatory and ethical standpoint, this could be viewed as a failure to provide timely and appropriate therapeutic support, potentially violating the duty of care. A third incorrect approach that relies heavily on verbal processing of traumatic events, even within a play context, may not be developmentally appropriate for all children, particularly younger ones or those experiencing significant trauma. Play therapy's strength lies in its nonverbal modality. Over-reliance on verbalization can bypass the child's natural processing mechanisms and may lead to re-traumatization or a sense of being misunderstood. This approach risks not fully leveraging the unique benefits of play therapy and could be seen as a deviation from established play therapy principles. A professional decision-making process for similar situations should involve a thorough assessment of the child's developmental stage, presenting concerns, and observed play behaviors. The therapist must continuously evaluate the child's engagement and response to therapeutic interventions, remaining flexible and adaptable. This involves a commitment to ongoing professional development and supervision to ensure adherence to ethical codes and best practices in play therapy, always prioritizing the child's well-being and the cultivation of their innate resilience.